You don't need to spend years in medical school or nursing school to land a high-paying healthcare job. Today, I'm going to show you 14 lucrative options. Hey there, welcome back to the channel. If you're new, my name is Andy. Today, we are diving into an exciting topic, healthcare jobs that don't require a medical degree. Yes, you heard that right. There are lucrative career paths in the healthcare industry that you can pursue without having to go through nursing school, medical school. Are you intrigued? Okay, then let's explore further. But before we jump into details, let me give you a quick overview. Whenever we think of healthcare, right? Whenever we hear healthcare, we often think of doctors and nurses. However, the field is much more broader than that. There are several options. There are different career paths in healthcare that don't require you to be a nurse or you to be a doctor in order for you to get paid well. We will debunk the idea that you need a medical degree or you need a bachelor's degree to secure a well-paying job in healthcare. Get ready to discover some exciting new alternatives. The reason why I'm doing this video is because there are so many people that would like to come into healthcare, but they're not able to pursue a full, maybe 4-year college or extensive medical school or nursing school, and it often deters them from pursuing their career, from going after something that they love. And as a result of that, many of them give up. They overlook diverse opportunities that they have in the healthcare field and in turn limit their career opportunities. Now, let's go into the different options. Number one, medical transcriptionist. A medical transcriptionist listens to physicians' detections and they transcribe them into a medical record. When a physician sees the patient and they detect their notes, they detect their treatment plan, they detect their assessments, the medical transcriptionist will come and transcribe those into the patient's electronic records. And these people make about $30,000 a year. Number two is a certified nursing assistant. By now, everybody in this channel know what a certified nursing assistant is. A certified nursing assistant is a nurse's help. So they are the people that work in nursing homes. In the hospital, they are called patient techs, where they help the nurses take care of the patient. They give the patient a bed bath, give them water, help them to use the bathroom, whatever the patient may need. They are there to help out. They answer call lights and things like that. They make about $30,000 a year. Number three is an EMT or emergency medical technician. Emergency medical technician works in an ambulance. For example, in the US, when someone calls 911, they are the ones that are dispatched to go into the patient's home or to go to a nursing home to pick up the patient. So they go there, they see the patient. They are trained as the first responders. That's what other places call them, to kind of assess the patient, know what the patient needs, and the best hospital to route that patient to. So they are able to do CPR, they are able to do EKGs, they are able to give emergency medication through IV. So that means they are able to start IV and push the medication if they need to. They are able to give like an epinephrine, which is an allergy medication, if a patient needs, and then they'll transport the patient to the hospital. And when they go to the hospital, they will now relay the information of what is going on with the patient to the emergency room department. They make about $35,000 a year. Number four is a pharmacy tech. So a pharmacy tech works in a pharmacy. They help the pharmacist. They make sure that the medication is well stocked. They make sure that the medication is labeled, and they help out the pharmacist to label things, stock up the medication cabinet, make sure that things are organized in the pharmacy. Pharmacy tech makes about $36,000 a year. Number 5 is a medical assistant. A medical assistant gets a training or certification to work in a medical office, outpatient clinics, like where I'm working right now. The person that assists me is called a medical assistant or an MA. They assist the doctor or the nurse practitioner in rooming the patient, taking the vital signs, getting the information of why the patient is here, and relating that to the nurse practitioner or the doctor. Most of them are also able to draw blood. They can also do an EKG, and then they route it to the nurse practitioner or the doctor that is taking care of the patient. A medical assistant makes about $37,000 a year. Number 6 is a phlebotomist. A phlebotomist is a person that is well trained to draw blood from patients. So you will mostly find them in hospitals or outpatient clinics. When the physician in the hospital puts an order for blood, they go in the system, go around from room to room and collect blood, and draw blood. They work in the morning, afternoon, night. A phlebotomist makes about $37,000 a year. Number 7 is a dispensing optician. A dispensing optician works in an eye clinic. They assist the optometrist with measuring a patient's glasses, getting the prescription, measuring the length, the size, the width of the patient's glasses, assisting the patient in ordering their lenses and their glasses. So, when you go to an eye doctor and the eye doctor gives a prescription, when you go, you give that prescription to somebody in the office. They'll take your prescription, they assist you with picking your glasses, and they collect measurements, they check everything, and then they order your glasses for you. So those are dispensing opticians, and they make about $37,000 a year. Number 8 is a dental assistant. A dental assistant works in a dental clinic. So of course they help the dentist to room the patients. They do the x-ray of the patient's mouth. They put all the equipment, they set up basically for the dentist. And then when the dentist comes, they just, take care of you, and then they'll come back and clean up behind the dentist. So the dental assistant makes about $38,000 a year. Number 9 is a dialysis technician. A dialysis technician works in a dialysis clinic. Dialysis is for patients that have kidney failure. So when they have chronic kidney failure, their kidney is not functioning as they supposed to, and they need help, that's when they start getting dialysis. Most patients get dialysis 3 times a week. So these dialysis technicians are the ones that will make sure that the equipment is well kept and clean. They again assist the doctor in getting the things, setting up the room, making sure the things are neat and ready for the doctors to see the patient. And they also go behind the doctor when the patient has finished completed treatment to clean up after the doctor. And they make about $40,000 a year. Number 10 is a medical record specialist. A medical record specialist is someone that is in charge of medical records. So they look at the patient's records. They have to be really good in data collection, computers, things like that, because they look at the patient's record, they audit the patient's medical records. Sometimes when a patient requests for their medical records, they are the ones that will go through, make sure that they set up everything, they gather the information that the patient needs, that they get consent, and then they send these medical records to appropriate location. They also look for billing errors, and they also look to make sure that everything in the patient's medical record has been charted appropriately. They make about $46,000 a year. Number 11 is a massage therapist. I don't think that one needs explanation. We all know who a massage therapist is. Oh my God, I think I need a massage. Whew. So a massage therapist is someone that does massage. So when you go to a massage parlor, they are the ones that will give you that nice soothing massage depending on what type. Do you want deep? Do you want light? Do you want full body, half body, whatever? So they also go through training because they need to know the anatomy of the body. They need to know the point areas that they need to massage so they don't break people's back. So interestingly, for people that don't know, massage therapists actually have to go through some education to be licensed as a massage therapist. And they make about $46,000 a year plus tips. Number 12 is a surgical tech. A surgical tech, or some people call them scrub tech, are the ones that work in the operating room. They assist the surgeons to make sure that the surgery is well set up, that the equipment is well set up for the doctor. They know what equipment is needed for what surgery. They make sure that everything is clean and is sterile. They assist the surgeons during surgery. Again, you have to go through training because, surgery is a very sensitive thing. So they have to, especially when it comes to bacteria and stuff like that, they have to make sure that the surgery room is at the right temperature, that the equipment are appropriate for what type of surgery is being done. Whatever the surgeon asks for, they'll hand it to the surgeon. They make about $48,000 a year. Okay. Number 13 is emergency dispatch. If you live in US, when people call 911, there are people that answer the phone and they say, 911, how can I help you? Those are the emergency dispatch. Those are the people that will dispatch the emergency medical technician to the house that has called 911. Those are the same people that will also help whoever is on the phone they guide them through CPR if needed. So let's say someone called and says someone is unconscious or someone is choking, they will be on the phone and help them do CPR. They'll tell them what to do. If someone is bleeding, they'll guide them on how to put pressure on that wound in order for that patient not to bleed or that person not to bleed out. So that person that they talk on the phone that guide them or usually dispense the emergency medical technicians to the home are the emergency dispatch. And those people make about $46,000 a year. That job is kind of interesting. I would like to just have like a day to just visit there and just kind of see, because I know I've seen it in movie before where they have like these huge computers in front of them and they just answer calls. So many, like they stay in a huge room and just answer calls all day. So I would really love to have a day to just visit and see how it goes. I think it's a very, very important job. So consider. Number 14 is an EKG tech, electrocardiogram technician. So these people work in hospitals. Some of them work in outpatient clinics. So they have to know the correct places to attach the electrodes to the patient so that the EKG can be read. What's interesting is that medical assistants also are trained to do EKG, but they don't make as much money as these people, okay? So these people, that is specifically their job, and they make about $55,000 a year. So the potential salaries for these jobs are impressive without a college degree. Companies are actually actively looking for people in these roles. These careers are actively on the rise, and there are people that are looking for people to hire to these roles. So in conclusion, there are a variety of jobs that do not require a medical degree. I encourage you to explore more of this role. Share your thoughts and comments in the comment section. I would love to answer your questions. If you have any questions regarding these roles, regarding how you can get this certification or how you can become one. Remember that the healthcare industry is full of opportunities. Don't limit yourself. I know that most people want to be RNs, registered nurse or whatever. But there are people that do want to be in the medical field, but they don't have the opportunity. And also, these roles can be a stepping stone. So it doesn't mean that because you are in this role that your career ends. No. If you still want to be a registered nurse, if you still want to go into if you still want to further your education higher, this should not stop you. This is a great stepping stone into your career. Don't limit yourself. The perfect job might be closer than what you think. So explore. Thank you so much for watching this video. Until my next video, I love you with the love of God. Don't forget to like this video, subscribe, and share. Until my next video,